Did you know that each year in the United States, about 11,500 new cases of cervical cancer are diagnosed, and about 4,000 women die of cervical cancer? Wow. Hello, I'm Jean Drummond, President and CEO of HCD International. And in recognition of Cervical Cancer Awareness Month this January, we're pleased to present another Voices series focused on cervical cancer. So we're pleased today to have two of our most amazing community health liaisons that are just so passionate about this work. We've got Jean, so come on, Jean Gaskins, my namesake, and we have Jennifer Cano to have this important discussion about cervical cancer screening, treatment, and prevention. So also, we want to talk about how our team really support our members or enrollees with their cancer screening appointments, and just how we really deliver amazing service to each one of our members. It's so important, our engagement. Yes. So Jennifer, would you share with us what is cervical cancer?
Thank you, Ms. Drummond. Yeah, I'm excited to share.
Yeah.
So according to the CDC, cervical cancer occurs when the cells in the cervix grow uncontrollably. The cervix connects the vagina to the uterus.
Okay.
And that's where the baby develops during pregnancy.
Okay, all right, good. I'm so glad you're giving us a little anatomy lesson there for those of us that may not know, but good. So it's when the cervical cells grow uncontrollably. All right. Well, thank you so much for sharing that with us. I know it's important that we note that in the early stages, symptoms may not, appear.
Yes.
And so the cancer progresses, and I understand it can cause vaginal bleeding after intercourse, between periods, or even after menopause. Sometimes there's heavier or longer menstrual bleeding, watery and bloody vaginal discharge with a foul odor, even pelvic pain and pain during intercourse. And so that's really important. We want to reduce the risk of, and understand the signs of cervical cancer. So team, so let me understand this. Anyone with a cervix, most ladies should know they still have a cervix, right? Is at risk for getting cervical cancer. So help us to understand, what can we do to reduce that risk?
Yeah, absolutely. So in order to reduce the risk, it is important for women to get regular cervical cancer screenings, which include the HPV vaccine and pap smears.
Okay, HPV vaccines and pap smears. And Jean, anything else?
Yes, avoid smoking.
Okay.
And wear condoms.
Wow. I'm so glad we have y'all. Y'all are so knowledgeable about this, because I don't know that it's really intuitive to think that smoking and cervical cancer would be connected. That's why it's so important for us to have voices, right?
Yeah.
For us to share and to educate. So let me just say that. You said get your regular pap smear and HPV, which stands for human papillovirus, right? Test. Avoid smoking. Use condoms. Yes. And good stuff. All right. So Jean, HCDI is a data-driven organization. All of our engagement and our population health, our work really begins with data. And so when I think about cervical cancer, share with us some of the data, like how impactful is this? How much is this really making, a challenge for especially the United States?
Yes, absolutely. The American Cancer Society estimates for cervical cancer in the United States for 2024 was about 13,820 new cases of invasive cervical cancer will be diagnosed. About 4,360 women will die from cervical cancer.
Wow, that's amazing. Because when you think about it, that impacts children, families, society, economics. That's why we gotta keep our voices out there, right?
Yeah, so cervical cancer is mostly commonly diagnosed in women between the ages of 35 and 44, with the average age of diagnosis being 50.
Wow. So think about that. So you're really now a mom, you've got probably a teenager, you've got just in the prime of your life, and then you get this diagnosis. That's something, yeah.
So Ms. Drummond, if you're 30 and older,
Yes.
people should talk to their doctor about screening options. Regular tests can be to help detect changes early on.
Okay, and that's what we want, is early detection and prevention.
Yes,
Yes,
prevention.
good. Thank you so much, Jean, for
You're
sharing that
welcome.
data. So, at HCDI, I'm really excited that we address those barriers. So very important to the cervical cancer screening in all communities, right? Whether we're in the rural community, whether urban community, across all, races and ethnicities. And we do this through our dedicated, community liaisons. We don't like to use language lines. That's why we have staff that speak so many different languages, such as, Jennifer and Jean, to really ensure that underserved populations are well informed and have access to these screenings. Earlier I talked about our human-centered approach, and I just love it when you all come back with stories from, members of our health plan clients. So, Jennifer, I know you have so many different stories. Can you share one with us?
Yes, I once contacted a member who needed to have her cervical cancer screening completed.
Okay.
She told me that she felt like she did not need the screening because she felt healthy. I told her I understood.
Wow, wait a minute, let's just stop right there. So you told her you understood. I love that because number one, that's active listening. That's demonstrating empathy. You didn't judge her. You didn't say, look, you don't understand. Let me help you. But that's so important. I'm sorry, I know you were telling the story, but I think that's so very critical because ultimately we're engaging, we're educating, we're empowering. We want to help the member to understand the need. So, okay, go ahead. So what happened? I need to hear
And
this.
that's part of our job, to help the member understand why these screenings are important.
Right. So there you go again. That's shared decision making.
Yes.
So now you're not just saying to her, you got to do this, but you're allowing her to make that decision and come to the reasoning because of her education and her decision to make that change. All right, I promise I won't interrupt you anymore. Go ahead.
Okay, so I explained to her why cervical cancer screenings are important. I also told her that early signs of cancer, they're not obvious. So that is why the preventative screenings are so important in order to catch those abnormal cells before they turn into something more serious.
Jennifer, thank you so much. I'm just grateful that you are just the empathy, the active listening, the sharing is just so amazing. Awesome.
So a call to action is to get screened for cervical cancer, get your HPV and Pap test done earlier to prevent cervical cancer.
Y para mi familia latina, si usted tiene la edad de 21 años o más y no ha tenido el examen de Papa Nicolau o el examen del HPV, por favor llame a su doctor y haga su cita hoy.
There you have it. You've heard it in Spanish. That's awesome. That's the HCDI. That's the way that we do it. Thank you so much for joining us for another Voices, vital opportunities to improve care, equity, and sustainability. See you next month.